the neonatal resuscitation is most important topic. Then I am going to do neonatal resuscitation. Then through my presentation I will do in a PowerPoint presentation and as a demonstration also. Then first of all we will see what is neonatal resuscitation. Then we see I am going to discuss what is resuscitation, who require resuscitation, purpose of neonatal resuscitation, assessing heart rate, assessing breathing, if not breathing what I am going to do, and when to stop resuscitation and follow-up care. Then anybody tell me what is neonatal resuscitation? Can you tell me? As a newly appointed nurses and midwives, I think you really know about what is neonatal resuscitation.
So, it is an intervention to help breathing and heartbeat after delivery baby.
Oh, good. So, neonatal resuscitation is intervention after delivered baby to help heartbeat and breathing. Then we will see who require resuscitation. The baby who has no spontaneous breathing or crying, and the baby's cyanosis, torn abscess, and heart rate less than 60, the baby wants to be resuscitated immediately. Then, what is the purpose of neonatal resuscitation? Because the above conditions are life-threatening condition, and then we have to recover the baby immediately. It is the purpose for resuscitation. Then, first we will see how to assess the baby. We have to assess baby breathing, heart rate, color and tone. Then assessing breathing, we have to assess rate and quality. Then heart rate and color. Color may be pink, blue, pale and tone. And you have to remember, keep baby covered, only exposing chest. Okay, it is most important thing. And you can see how to assess heart rate. That nurse is assessing heart rate through a pediatric neonatal stethoscope. The nurse is kept the stethoscope on the apex of the baby and assess heart rate. Then we have to open the airway. We have to open the airway by using two things. We have to maintain the position and we have to maintain the techniques. Then how to do? The position should be head in neutral position. You can see the towel was folded under the shoulders 2 to 3 centimeters thickness and head in neutral position. Then the technique is the chin lift and jaw thrust. But when you are doing chin lift, avoid overextension. And if the baby is floppy, you have to jaw thrust. Then regarding suction, the suction is not recommended in UK practice. Okay, you have to suction the baby if necessary. It means if thick meconium in the baby, you have to suck. But not recommended in UK practice. Normal babies not required suction. If thick meconium, you can suction the baby, but only in direct vision. Okay. Then, assessing breathing. You have to assess breathing in 3 techniques. Look in your eyes. You have to look. Listen by using your ears. Listen and feel. How to feel? You have to feel it by using your hands in the nose. Okay, and you have to assess breathing in those 3 techniques. And if breathing, no grunting, the baby's respiratory rate is 30 to 60 minutes. So there's no life-threatening condition. You can give the baby to mother and breastfeed and skin to skin contact. And you have to keep under observation the baby until stable for 6 hours. Okay? Then, if not breathing, you assess the airway, you assess the breathing, but not the baby is not breathing. What shall you do? You have to take immediate action. Take face mask, apply to mouth, nose, and chin. You have to take the face mask, apply to mouth, nose, and chin, not yours, the baby's. Okay? Then check rise of chest. If no chest rise after 3 to 5 breaths, reposition the airway. Always you have to stop and reassess. Stop and reassess. Then no breaths, so you have to reposition airway. Then you have to take the stethoscope again and reassess heart rate, and it means the heart rate is still low. Then you have, it means it is inadequate ventilation. The heart rate is low than 60 beats per minute, it means inadequate of ventilation. Then you have to give ventilation breaths to the baby. Means you can see the ventilation breath is given by the nurse. They continue giving breaths at 30 to 40 breaths per minute until baby breathes normally. Okay? You have to do ventilation breaths until baby breathes normally. Then again we reassess the baby, check what are going to check? The rise of the chest and heart rate. No, it's not breathing. So what shall you do? You can see that the picture, no heartbeat, less than 60 beats per minute. So the nurse is going to do chest compression. It's immediate action to be taken. You have to give chest compression. I will explain how to give chest compression in the demonstration. Okay? Then, when giving chest compression, encircle baby's chest with thumbs on the sternum. By your thumbs on the sternum, encircle the baby's chest by your thumbs and keep the thumbs on the sternum just below the nipple line, as this way. Okay? And then you have to compress chest by 1/3 depth, 3 times every breath. Okay? And then you have to reassess the baby again. Once heart rate is 60 beats per minute. Please continue chest compression. Why? Why are you going to discontinue the chest compression? Because the heart rate is more than 60. It's recovering. The baby is recovering. Our resuscitation is completed. It is success. Then, when you are going to resuscitate the baby, you have to keep in your mind, always stop and reassess. Always stop and reassess. Then, when to stop resuscitation? We are resuscitating the baby, and when to stop resuscitation? Breathing after 20 minutes and no gasping. When baby has a heart rate, the baby is normal. Means, so we can discontinue the resuscitation. But no breathing, no heart rate after 10 minutes, it's lifeless condition, and unfortunately we have to stop the resuscitation. Okay? And follow-up care. What are the follow-up care? We have to keep the baby. We can give the baby to mother. Why? To maintain baby's body temperature in a normal range. Therefore, we give the baby to mother, and we have to check blood glucose level also. And then we cannot stop it now. We have to keep under observation. The baby should be kept under observation until stable for 6 hours. Then, are there any questions?
I have questions. What's the difference between adults and neonatal resuscitation?
Good question. Excellent. You are asking about what is the difference between adult resuscitation and neonatal resuscitation. Yeah. There are three differences also. The first one is actually it is about chest compression. In adult chest compression, we use chest compression in adults when no signs of life. When adult is no signs of life, no pulse, no circulation, we are going to start chest compression. But in infants, in neonates, we start neonatal resuscitation with giving chest compression. We start chest compression when heart rate is less than 60 beats per minute. It's one difference. The other one is about chest compression ratio. In neonatal ratio is 3:1 and the adult ratio is 30:2. I will explain another difference also. It's in neonatal resuscitation, we give chest compression as like this way, use our thumbs, by using our thumbs. But in adult resuscitation, we use our hands this way and straight our hands and keep position as this way and we give this way. Okay, it's the main three differences between adult resuscitation and neonatal resuscitation. Then, good. I will show you the demonstration how to resuscitate the baby. Okay, let's see. The scenario is there's a baby. My colleagues called me to come and look because my colleague has delivered a baby who looks lifeless. Called me to come and take some action. Okay, then I came to that incident and I will demonstrate what actions I am going to take. Okay, then I have three things to do. First one is call for help. The second one is start the clock. The third one is the baby is always wet when we have to dry the baby immediately. The first one I am going to demonstrate you. Call for help. Hello, are there any nurses? Are there any midwives? Please come and help me. There's an emergency situation. Please come and help me. Then I ask for help. Then second, I start the clock because the clock is all actually important thing. Then what am I going to do? I have to dry the baby immediately because the baby is wet. When I am drying the baby, I have to assess the color of the skin, the muscle tone, the response to stimulus also. Okay, then the towel is wet and I have to keep it away, and another towel I will take another towel and cover the baby immediately. But you have to keep your mind, the chest, only chest should be open. Only chest should be open. You have to cover the baby. Okay. Then we have to assess the baby. We have to take stethoscope, pediatric stethoscope, because we have to assess initially listening to the heart rate immediately. Okay. Then I assess the heart rate also. Then the heart rate is more than 60 minutes per minutes, so it's normal. Then I will tell you how to assess airway. Airway, we have to put head in neutral position in this way. Okay, in this way, neutral position. We can use a towel to fold under the shoulders, 2 to 3 thickness, 2 to 3 centimeter thickness under the shoulder, and we facilitate airway in head in neutral position. If the baby is floppy, we can use jaw thrust method also. Jaw thrust method also if the baby is floppy. Then we have to The second one is breathing. How are we going to assess breathing? Look, listen and feel. Then I am going to assess breathing. I put my face like this way. My eyes are focused to the chest of the baby. Then I put my face this way. I look, whether the chest is rising, and I hear the breathing pattern, and I feel like this way the breathing. Then airways good. Then I am going to assess the heart rate on the apex. The heart rate is good. The baby is breathing. The heart rate 30 to 60. The respiration rate 30 to 60. Heart rate more than 60 beats per minute. So I can give the baby to mother. No need for resuscitation. Then, if the baby is still not breathing, what shall we do? We have to take emergency action, because always my partners are there. They are standing in there, and they will help me to resuscitate the baby. Then I have to take the ambu bag. Okay, we have to apply the mask over the nose, mouth and chin, like this way. Mouth, nose and chin. I put the mask as this way and put my hands, fingers in C to E position, C position. I have to seal the mask on the baby's face, and I give inflation breaths. 5 breaths are given, then each lasting 2 to 3 seconds. Then when I am going to do inflation breaths, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3,